Dupuytren's Contracture, Discovering What It Is by Carrie Beth McIntyre. Who does it affect? Dupuytren's is most commonly found in men aged 40 to 60 years old, those of European descent, those with a family history of the disease, those who smoke, drink, and/or have diabetes. Basic overview. What is it? Dupuytren's Contracture is a pathological condition that affects the palms and fingers of the hand. As it progresses, the fingers contract inward toward the palm, and over time, it becomes impossible for the fingers to straighten. Here is a picture of the progression of Dupuytren's. As you can see in grade 1, it is just becoming firm, and then over time, the finger bends inward, becoming impossible to straighten. Alright, there is much debate over what is the cause of Dupuytren's. Some people say that manual labor of the hands, such as using a jackhammer, can bring on Dupuytren's. There are several theories about what else causes this disease, although nothing is certain. Family history, as well as life choices such as drinking and smoking, seem to increase the chances of having Dupuytren's. However, researchers are not exactly sure because there's just not a lot of evidence one way or another what can cause it. What does it affect? The only part of the body that is affected is either one or both hands. Dupuytren's typically affects the fourth and/or fifth fingers as well as the palm of the hand. As the disease develops, there is a rapid increase in fibroblast. So typically, it will affect one hand more severely than the other, but most commonly it will affect both hands to some extent, and even occasionally the feet. Here's a picture of a person with Dupuytren's. As you can see, it's just in the fifth finger, and it's in one of the more probably stage 2, as it's just you can see the cord starting to tighten, and his pinky finger is no longer able to be completely straightened. The organ system functions. As Dupuytren's progresses, it becomes impossible to straighten the fingers, and so the muscle is affected. Also, the ligaments in the hand are affected as well. In addition, the nervous system is also affected because attempting to stretch or extend the diseased finger causes pain. It's basically the same as just trying to push your fingers back further than they should be able to go. It's the same type of pain, just trying to force your fingers to do something that they cannot do. Signs and symptoms. In the first stages of the disease, the palm will thicken in one area, usually right underneath the finger that will become bent. Then the thickened area turns into a nodule, and blanching occurs upon bending of the affected finger backwards. Over time, the nodule will turn into a thick cord-like band of tissue that runs from the palm to the finger, as we saw in that picture. Slowly, the cord begins to tighten little by little and curls the finger in toward the palm. This can happen in a couple of months in severe cases, but typically it's over several years. So at first it's not that big of a deal until it becomes bad enough that you can no longer use your hand for regular activities. Some more signs and symptoms. Dupuytren's progresses very slowly. In most cases, it takes years to become advanced enough for treatment. Eventually, a person with this disease will lose ability to do even simple tasks, such as pick up change off of a table. Another thing is even just putting hands into a pocket or shaking somebody else's hand can become impossible. Treatments. Once the disease is identified, there are many treatments available. And identifying the disease is basically the doctor will look at your hand, try to straighten out your fingers, ask you to lay your hand flat on the table, just simple things like that to see how flexible your fingers are. Typically, it is advised to wait to be treated until it becomes hard to partake in tasks, especially if you want to go with the surgery option. There's no actual cure, but there are ways to correct the effects of Dupuytren's. Even with treatment, there is no guarantee the effects will stay away. Oftentimes, if somebody gets in one finger, even if they get it corrected in that finger, it can come back in another finger or the other hand or whatever. Treatments continued. Most common form of treatment is surgery. Typically, it has the most long-term success, although the downside is that surgery has a long recovery period and physical therapy is required. Also, you will then have a scar running through the palm of your hand where it was cut to remove the cord. Here's a picture of somebody's palm opened up, and you can just see the thick cord that is the result of this disease. Another form of treatment is needle fascotomy. It involves injecting a needle into the palm to cut the tightened cord and therefore relieve pressure. And so instead of removing the whole thing, they'll just cut it into pieces. It's safer than surgery, but it is not as successful in the long term. It's easier for it to just grow back. One of the newest forms of treatment is enzyme injections. The palm is injected with enzymes, then after a period of time, the doctor attempts to break up the cord by stretching out the fingers. This is not always successful the first time, and because it is new to the market, it is not yet available everywhere. It is nicer because you don't have to do surgery, and it's better recovery time, although sometimes they have to be injected 3 or 4 times before it actually works. Short and long-term consequences. The more advanced the disease is, the less use a person will have of their hand. Also, as it develops, it will become increasingly painful to use the hand in everyday tasks. Putting hand into a pocket or shaking someone's hand can become impossible. Even after treatment, a person will be conscious of what they used their hands for because it can come back at any time. A lot of people think that like a certain task brought on the disease in the first place, and so they'll avoid using the palms of their hand for any sort of forceful activity like using a jackhammer. And here are my references. Thank you for listening.